Rats and mice are rodents that may be linked to the transmission of various infectious diseases. These animals carry pathogens such as bacteria, viruses, and parasites, which can be transmitted to humans in various ways, either through their urine, feces, saliva, bites, or by vectors such as fleas and ticks that parasitize them. Below, I mentioned some of the best-known diseases associated with these rodents. 1. Leptospirosis. Causal agent, Leptospira bacteria. Transmission, contact with water, soil, or food contaminated with urine from infected rats. Symptoms: fever, muscle pain, headache, jaundice, yellowing of the skin, and in severe cases, kidney or liver failure. Prevention: avoid contact with stagnant water, use protection when handling waste or contaminated materials, and control rodent populations. 2. Hantavirus. Causal agent, virus of the Hantaviridae family. Transmission: inhalation of particles of feces, urine, or saliva of infected rodents, especially in closed spaces such as granaries or warehouses. Symptoms: fever, muscle aches, breathing difficulties, and in severe cases, hantavirus pulmonary syndrome, HPS, which can be fatal. Prevention: ventilate closed areas before cleaning them, use masks and gloves, and seal cracks or gaps in homes to prevent the entry of rodents. 3. Plague. Causal agent, Yersinia pestis bacteria. Transmission, mainly through fleas that have bitten infected rodents. It can also be transmitted by direct contact with tissues or fluids of infected animals. Symptoms: depends on the form of the disease, bubonic, septicemic, or pneumonic. Includes fever, swollen lymph nodes, buboes, chills, and weakness. Prevention: flee and rodent control, and avoid contact with sick or dead animals. For rat bite fever, causal agent, bacteria such as Streptobacillus moniliformis or Spirillum minus. Transmission: bite or scratch from an infected rat or consumption of contaminated food or water. Symptoms: fever, muscle pain, vomiting, skin rashes, and in severe cases, heart or brain complications. Prevention: avoid contact with rodents and maintain hygiene measures in food and water. 5. Toxoplasmosis. Causal agent, Toxoplasma gondii parasite. Transmission: although cats are the main hosts, rodents can be carriers and transmit the parasite through their feces or by consumption of contaminated meat. Symptoms: in immunocompetent people, it may be asymptomatic or cause mild flu-like symptoms. In immunosuppressed or pregnant people, it can be severe. Prevention: cook food thoroughly, wash fruits and vegetables, and avoid contact with rodent or cat feces. 6. Salmonellosis. Causal agent, bacteria of the Salmonella genus. Transmission: consumption of food or water contaminated with rodent feces. Symptoms: diarrhea, fever, abdominal pain, and vomiting. Prevention: hygiene in food handling, hand washing, and pest control. 7. Lyme disease, indirectly associated. Causal agent, Borrelia burgdorferi bacteria. Transmission: although ticks are the main vector, rodents can be reservoirs of the bacteria. Symptoms: bullseye rash, fever, fatigue, and in advanced stages, neurological or joint involvement. Prevention: control ticks and avoid unprotected wooded or grassy areas. General prevention measures: pest control, seal cracks and gaps in homes, eliminate food and water sources, and use traps or rodenticides safely. Hygiene: frequent hand washing, especially after handling trash or potentially contaminated materials. Personal protection: wear gloves and masks when cleaning areas with rodents. Education: inform the community about the risks and how to prevent exposure to rodents and their diseases. Rats and mice are adaptable animals and can proliferate in urban and rural environments, so their control is essential to prevent the spread of these diseases.